Hi, everyone, and welcome to the last session of the second day of the Governor's Office of Disability Affairs Conference. We will have a presentation at this time from the Louisiana Department of Health, Office of Behavioral Health, Charlene Gradney, who currently serves as a program manager for the Louisiana Department of Health, where she oversees the community-based supports and program compliance section. And she will be discussing some programs and services through the Louisiana Office of Behavioral Health. So, sorry about that. Charlene, I'll turn it over to you.
Sure. Thank you, Bambi. Good afternoon, everybody. It's really a pleasure to be here with you all. To those of you who have been here throughout the conference, I'm so glad you stuck around for this afternoon to hear this presentation with the Office of Behavioral Health. So I know it's late in the day. I'm going to try to keep it upbeat and giving you guys some high-level information. So we're going to take a couple of approaches with our presentation. First part of our presentation, I want to give you all an overview of what is the Office of Behavioral Health, some of the services and programs that we have available in our infrastructure for services throughout the state. And then the second part, I want to go over 988 crisis line with you guys. This was just implemented on July 16th. It was implemented around the country as part of national law. And it is so exciting. And we are just at this pivotal moment in behavioral health services in the country. And it's exciting and thrilling to be a part of it. So just, there we go. The Office of Behavioral Health, we are one of the program offices within the Louisiana Department of Health. We manage and deliver services to that are necessary to improve the quality of life for citizens with behavioral health conditions. And that includes mental illness as well as addictive disorders. So our agency contracts with subject matter consultants, and we act as, and we have contractors that are subject matter consultants for the Children's Coordinated System of Care, as well as partnering with Medicaid for behavioral health services through Medicaid's Healthy Louisiana project. So we work closely with Medicaid for behavioral health services, as well as with all of our sister agencies within the Department of Health, because we know that whether your illness is a chronic medical condition, it's a behavioral health condition, it's an intellectual or developmental disability, it's all in one person, and we have to treat that person, that individual, as one. So all services come together. We deliver direct care through hospitalization and have oversight over our behavioral health community-based treatment programs through the human service districts and authorities. So some of you may know that we have 2 state-operated hospitals for inpatient mental health in Louisiana. That's the East Louisiana Mental Health System in Jackson, Louisiana, and also Central Louisiana the Central Louisiana Human Hospital System in Pineville, Louisiana. Those are our 2 state-operated inpatient mental health facilities. And we also do cooperative endeavor agreements, or we call them CEAs, for beds, and that we contract with private entities for additional inpatient psychiatric beds as needed. And with our human service districts, we also oversee not only services to the Medicaid population, but also the non-Medicaid population, which are the uninsured, the underinsured, the indigent population. So talking a little bit more about our behavioral health service delivery system, we have 10 local governing entities throughout the state. Formerly, these were known as regions, and each consist of, they have a regional authority over the parishes that are under their purview. And with that, all of the regions by legislative statute around 2010 became local governing entities, and under the direct supervision of a local governing board with an executive director who is hired and supervised by the local governing board. And the goal of that is to make sure that community-based services are just that. They're community-based, they are driven by the community, the voice of the people in the community who know the community, because we know that what may work in New Orleans would not work in Lake Charles and may not work in Monroe. So we have to work with what is available with the community partners to make sure that the resources that are available are consistent with the needs in that area and what that population need in that area and what they would respond best to. And the next slide, these are our 10 local governing entities. So there is a list there of all 10, and the map shows which parishes are included in all 10. And these are our safety net system. So they provide behavioral health services to include substance use disorder treatment and mental health treatment throughout the state and the local communities, regardless of insurance status. So whether someone has Medicaid or is uninsured or underinsured, this is our safety net system to provide behavioral health services throughout the state. And they receive direct funding through the Department of Health. They receive funding that passes through the Department of Health from the federal government to us and then to the local governing districts to support that safety net system. And as well as being local governing entities, they all are also able to apply for separate funding and independent funding, as most of them do. So in addition to the local governing entities, we have the Healthy Louisiana Health Plans, which are the Medicaid system. And in Louisiana, our Medicaid system is integrated care that combines both primary and behavioral health needs. So it is not a carve out in Louisiana where one entity manages behavioral health and another entity manages primary care for Medicaid members. The Medicaid managed care organizations will oversee both primary care and behavioral health needs for Medicaid members. The 5 managed care organizations are Aetna Better Health, AmeriHealth Caritas of Louisiana, Healthy Blue of Louisiana, Louisiana Healthcare Connections, and United Healthcare Community Plan. Effective next year, that will be the implementation of new contracts for the managed care entities for the health plans with Healthy Louisiana, and there will be a 6th managed care organization, which will be Humana. And through the managed care organizations, members can access specialized behavioral health services. So any Medicaid member who has an assigned managed care organization can access specialized behavioral health services. And I've listed just a few there of some resources and services that are available. Mental health rehabilitation, community-based services and supports, assertive community treatment, which again is another intensive community-based model that provides services to members with behavioral health needs in the home and in the community. That at least half of those services have to be performed in the community. So it's not facility-based or clinic-based. And really the goal of a lot of the services moving forward are meeting members where they are and where they live in their community to ensure they have supports in their community, because we know that's where the most supports are needed, is when they're out at their jobs, in their homes, at the coffee shop, at where they like to hang out, that they know supports are there in the community. So there's outpatient and intensive outpatient treatment programs. Through Medicaid managed care organizations, members can get treatment through a licensed mental health practitioner on an outpatient basis. We also have supportive services that are available through the Medicaid managed care organizations, such as supported employment. This was just implemented earlier this year. We implemented the evidence-based model of individual placements and supports. And that is a national and international evidence-based model of supported employment for individuals with mental illness and other behavioral health conditions. It is proven to be effective in helping members to obtain employment and maintain employment in a job of their choosing. So it's not a position or a job is selected for them. The members with this model, get to select what type of job they want to do and receive supports and services to help them to be successful. And studies and data shows that if someone is successful at home, in the community with their employment, then that also is an incentive, and they're typically going to be more likely to be successful in maintaining their sobriety or their recovery from any behavioral health conditions. We also, in last year, 2021, implemented peer support services as a Medicaid reimbursable service. Peer support services have long been a part of our model with behavioral health services in Louisiana. We were excited to take this big step to make it Medicaid reimbursable. And We are still in the initial phase of implementation with peer support services. So it is right now, the provider type that is allowed to bill for services are the local governing entities, but we are working on implementing and planning future phases to expand that to other provider types to be able to bill. And peer support services are provided by people with lived experience with behavioral health conditions themselves, and they know firsthand the challenges. They know firsthand how to overcome a lot of the challenges they will see during the process of engaging in treatment, of being successful in treatment, how to access resources. And we cannot stress enough how invaluable that is to have peers as part of the treatment team to support the process and help individuals understand and have someone with them who understands the challenges of engaging in treatment, staying in treatment, maintaining their recovery. That's been invaluable. It's as far as outcomes, improved outcomes, also less reliance on more expensive levels of care have been shown to be some of the benefits of peer support services as part of the treatment team. Crisis services are also available through the Medicaid managed care organizations. And we're going to get into more details about that later on when we talk about 988 and the crisis response system that was just implemented this year. Addiction services with all ASAM levels of care, and ASAM being the American Society of Addiction Medicine, and the levels of care. All the services are available through the Medicaid managed care organizations for Medicaid members, as well as opioid treatment programs and medication-assisted treatment in response to the opioid epidemic in Louisiana and around the country to make those services more accessible. Okay. So next, I'm going to spend a good bit of time with us talking about 988 and crisis support services that have recently been implemented in Louisiana and in the country. So on July 16th, 988 became the crisis line for the country. So we're going to talk about what is 988 and an overview of the National Prevention Suicide Lifeline, National Suicide Prevention Lifeline, how Lifeline calls are routed, planning and implementation in Louisiana, and our new crisis response system in Louisiana. What is 988? And I love this. Hope has a new number, and it is 988. So on July 16th, a new 3-digit dialing code 988 began routing callers from the National Suicide Prevention Lifeline. So previously, when someone was in a crisis or expressing suicidal thoughts, we would tell them to dial 1-800-273-TALK 8255. 10-digit number, very long. I've been working in behavioral health for decades and still could never remember it. I would have to look it up when we give it. So now that is condensed to 988. Simple, short, easy to remember, works around the country. That wherever somebody is, if they dial 988, if they are in a behavioral health, a mental health crisis, they can call 988 and be linked to someone within their local area most of the time for support services, to talk with, to help them to that next step. So the vision for 988 and crisis services. So as I said, on July 16th, less than 2 weeks ago, Saturday before last, a transformative moment in crisis care system in the United States, that throughout the country, the FCC ordered telecommunication systems. This was by law that everyone had to have established 988 or if someone was in a behavioral health or a mental health crisis. So while it's an exciting time to reimagine how we provide crisis services in the United States, the full vision of a transformed crisis care system with 988 at its core will not be built overnight. And we know it has short-term and long-term goals. It will require continued collaboration, commitment, and support to make it effective, appropriate, and sustainable, both from the public and the private sectors combined. So this is really going to be a collaborative effort to make this a success. In the short term, we are looking to strengthen and expand the current Lifeline Crisis Center infrastructure and capacity to ensure trained crisis counselors are available to quickly respond to 988 via call, text, or chat. In the long term, our vision is to build a robust crisis care response system across the country that links callers to community-based providers who can deliver a full range of crisis care services, if needed, like mobile crisis teams or stabilization centers. This more robust system will be essential to meeting the crisis needs across the nation and within our great state of Louisiana. So this is a pivotal moment. It is the first step for developing the 988 line and looking at a new crisis response system for Louisiana. The impact of implementing 988. A 988 crisis line is effectively resourced and promoted will connect a person who is in a mental health crisis to a trained counselor who can address their immediate needs and help connect them to ongoing care. It also helps to reduce healthcare spending with more cost-effective early intervention. As opposed to if someone calls 911, lots of times a 988 call when someone is in a behavioral health crisis, more than 80% of the time, it can be resolved or de-escalated with a professional trained counselor on the phone, and it's not necessary to dispatch law enforcement or an ambulance. And so this reduces reliance on those more costly resources like an ambulance, getting someone to the emergency room, or law enforcement. So, and they can then use those resources that are needed in other areas where it truly is a public safety issue or a public health issue where law enforcement or public health is needed. And this also helps to meet that growing need for crisis intervention. During the pandemic, there has just been data has shown an increasing of depression and anxiety and other behavioral health conditions. And so there really is, and the data shows, a need for more community-based supports and resources to really meet people where they are. And this also helps to end that stigma that continues to live of accessing mental health care and having a mental health or a behavioral health condition. When we make it as accessible as dialing 911, then that shows that it's something for everyone, and it's a support for everyone, and it is everywhere to help reduce that stigma that there's attached to when asking for help for behavioral health and mental health needs. So in essence, when you've got a police, fire, or rescue emergency, you would call 911. When it's an urgent mental health need, you would call 988. 988, the beginning, how it all began. So mental health and suicide prevention advocates seeking a national, easy to remember 3-digit number for individuals in crisis took their idea to state leaders and to members of Congress. So the National Suicide Hotline Improvement Act was signed into law in August of 2018, and that directed the U.S. Federal Communications Commission in conjunction with other agencies to study this issue. So in July 2020, the FCC finalized its rule and order and designated that 988 would become effective July of this year, 2022, and all telecom providers had to make 988 operational. So as on July 16th of this year, a direct 3-digit line to train national suicide prevention lifeline counselors opened the door for millions of Americans, for the millions of people in Louisiana to get the help they need while sending a message throughout the country that healing, hope, and help are happening every day. And just kind of going back to, when we think about 911, and families do not hesitate. If you have a family member who's having a heart attack, no one hesitates. The family member doesn't hesitate. The person who's having that medical crisis doesn't hesitate to call 911, even in the midst of their anxiety. 911, that number has been around for decades and everybody remembers it. So even when you're in a panic or there's an anxiety or a crisis, everybody remembers call 911. And so there's the concern that, of course, remembering a 10 digit number for the National Suicide Prevention Hotline is not as easy to remember when you're in the middle of a crisis or when you're feeling anxious. So the push was really to make mental health services just as accessible as services for a primary chronic medical condition, a medical crisis, a safety issue. That so 988 was what was delivered from that movement from advocates and the federal government and federal partners around the country. And SAMHSA's guide, and SAMHSA has issued lots of toolkits and resource guides that can be used by the states as well as by partners around the state, provider agencies, anyone, for spreading the word about 988. And of course, that vision is with 988, there is always someone to talk to. Not only that 988 is there for the one who needs to talk, that they can call 988. But there is someone on that phone who is trained to respond to a crisis, and that those individuals also have a place to go if necessary in the midst of that crisis. So, and according to the Federal Communications Commission, the use of a dedicated 3-digit dialing code is a way to increase the effectiveness of suicide prevention efforts, increase access to crisis services, reduce the stigma surrounding suicide and mental health conditions, and increase access to a national suicide prevention and mental health crisis hotline. And again, just removing that stigma, making it accessible, and that not even thinking twice about calling that number, just like someone does with 911. So the Lifeline is administered by Vibrant Emotional Health, which is the nonprofit that is funded through the federal government with the Substance Abuse Mental Health Services Administration, which is part of the U.S. Department of Health and Hospitals. So Vibrant Emotional Health currently provides the following support to National Network for Crisis Call Centers. So it routes a call through the network to a local crisis center or a national backup center, and it pays for the incoming call charges. And it sets clinical standards and sector-wide best practices and provides constant quality assurance, training, assessments, and guidelines to ensure quality, effective help for people in crisis. So it is not a one and done that it's implemented. There are ongoing trainings, there's ongoing monitoring of the calls, how the calls are handled. And of course, with 988 being a new initiative, we know there are going to be lots of lessons learned. There's going to be lots of changes and improvements along the way as we learn lessons with implementation. And there's going to be ongoing training through Vibrant Emotional Health, and they're monitoring all the call centers to ensure there's quality services being provided, calls are being answered timely and by professionals. So it's a highly monitored, lots of quality assurance going into the program. And about the Lifeline, so all Lifeline centers have to be accredited. There are over 200 Lifeline centers across all 50 states. They have to be accredited with one of the accreditation committees. So that could be CARF or COA or JCO, AIRS. There's various different ones that they may select from for their accreditation, but it is a requirement that all of the call centers are accredited by a national accreditation body. And all of them are provided training, extensive training in crisis intervention and suicide prevention. And they must apply Lifeline's best practices on their calls. And again, they're monitored to ensure that these qualities are adhered to. And the local crisis centers are able to resolve 80 to 90% of crises via phone or chat without the need of other high cost interventions or dispatching law enforcement or ambulance. And at times there may be dispatching a mobile crisis response team, depending on the situation. And we're going to talk a little bit more about mobile crisis response teams as we go in a little bit deeper into the presentation. Okay. So a crisis call center is a resource for individuals going through mental health crises. They are often that first point of entry And in some instances, and in many instances, they can take the place of 911 calls that may have gone to a police dispatch, but may be more appropriate for a behavioral health, a mental health crisis response trained staff person, or a mobile crisis team to address. It offers supports 24 hours a day, 7 days a week. So why do we want local crisis centers? Because they are suicide prevention actions rooted in the communities. We have 2 crisis response centers, local crisis call centers in Louisiana, one in Shreveport area, one in the New Orleans area. And so they know the local communities and they know the linkages to local resources. They are more familiar and they can help to link someone to the appropriate resources. So how Lifeline calls are routed. So there are, as we said, there are over 200 call centers around the country. There are 9 national backups. So if in Louisiana, for example, our call lines get backed up, then there are 9 national backups who are able to take those calls outside of the state. And so there should always be timely response to the calls. There are 30 crisis chat centers. So someone can go online. We're going to show that in the next slide. Can go online and do the chat if they prefer not to call. We know lots of, especially our younger generation, rather than call, they prefer chatting or texting. So there are those options as well. There are also 3 Spanish centers. So if someone is in a crisis, they call the national line and they need the Spanish resources, they would press 2 when they call. And if if there is a veteran who is in crisis and needs assistance, there's also veteran call centers that specialize in veteran and those crisis issues. So they would press 1. And this is just a picture of the website for if anyone wants to go to the Lifeline chat, if they prefer not to do phone talk, or they prefer not to text, or they're not able to text, they can also go online to the Lifeline chat option and they can chat with a trained crisis response specialist through the Lifeline chat. Okay. So texting to 988. So part of what the Federal Communications Commission did when they required that July 16, 2022, all telecom systems had to be ready to receive this 988 option and operate it. So part of that was also that texting would be available to 988. So that is also an option when in crisis to text to 988. And we know that Americans are really becoming more reliant on text, and there's more texting happening than actually picking up the phone and calling someone. And sometimes that is the easiest way, or how someone feels safest to make that initial contact, that initial engagement. So they are able to receive text messages as well with 988. Right. So how is Louisiana prepared for 988 implementation? So there was a lot happening before July 16th and a lot continuing to happen, because July 16th was just the beginning and a pivotal moment, but still so much work to be done. Such a vision of how this is just that first step to growing just a robust crisis response system in Louisiana and in the country. So in February of 2021, the Office of Behavioral Health was awarded a planning grant for the implementation of 988. We assembled a coalition in April of 2021, a coalition of stakeholders to assist in providing feedback with drafting that implementation plan. And through a series of work groups, OBH finalized that implementation plan and was submitted to Vibrant, which was the federal identified partner for the initiative, in January of this year. OBH has also been awarded a 988 cooperative agreement federal grant that went into effect May 1st of this year to provide additional and ongoing support to the crisis contact centers to continue to build their infrastructure and capacity to respond to 988 calls. And more steps. So we continue to So our plan includes a summary of the plan that we have to submit to the federal government, includes a summary of the current capacity, identify challenges, strengths, goals, objectives, and action steps to ensure that Louisiana has 24/7 coverage for calls, chats, and texts to the National Crisis Line to 988. Adequate funding and sustained funding beyond these initial grants and so forth, and a plan to increase and maintain up to 90% in-state answer rate. So we know as the word begins to spread that utilization of 988 is going to increase. So we want to be ready for that growth, that we can always have answer at least 90% of the calls in state in Louisiana, and they not have to go to those backup call centers. And we want the support for the crisis centers to maintain Lifeline's operational standards. So we want ongoing training, monitoring, technical assistance to ensure that our crisis centers are providing the best quality services to callers when they call 988. And continuing to get the stakeholders involved to get feedback with the process as we move forward. And plan crisis centers to update and maintain community resources. So with that, we want to, as I said, we're going to talk about the Louisiana Crisis Response System that has been developed kind of in tandem with 988. And that is that next step. So once they've called, then where can they be referred when they are truly in a crisis, and for those follow-up services. And then the plan for outreach and marketing of the new 988 number, because we know we have to get the word out that this is 988 is the new number to call if you're in a mental health, a behavioral health crisis, and spreading that word and making sure it becomes embedded in everyone's brains just as much as 911 is, as much as 211 is when people want information. So our plans to continue the partnerships between 988 and the 911 centers, OBH we will continue to develop relationships with 911 dispatch centers and the crisis call centers in Louisiana. So we know that's going to be some cross training between the 911 public safety answering points and the 988 call centers, and making sure that there's ongoing communication, that as technology is developed, there's some common technology guide in order to ensure they are able to speak to each other, and that there's ongoing communication between the 911 public safety answering points and the 988 call centers, because it may be someone calls 911 and it may be, you might be more appropriate for 988, and vice versa. Someone calls 988 and it comes to their attention that it truly is a public safety issue and that they do need 911 or law enforcement at the scene. Our top accomplishments to date, we've made significant accomplishments in development and implementing 988. So we implemented on July 16th, so yay for that. We developed and facilitated a coalition of diverse key stakeholders to help inform the development of our 988 statewide implementation plan. That coalition has since transitioned to our crisis coalition. So they focus and provide feedback on the development of the broader crisis continuum that will encompass community-based resources and be those resources for people who are calling 988 and need some supports and services in the community. They help to develop a plan to ensure 24/7 statewide coverage for Lifeline calls, chats, and texts. Developed a plan to expand and sustain crisis center capacity to increase the in-state answer rate for primary and backup coverage. So we know that is going to be a next step, that we will need to develop new additional capacity moving forward in order to ensure we have at least 90% of our calls being answered in the state and not going to the backup lines. And we have contracts that have been established with 2 certified Lifeline contact crisis centers to provide that 24/7 statewide primary and backup coverage. As I said earlier, our 2 crisis call centers are Via Link, which has offices in New Orleans and Orleans and St. Tammany parishes. That call center will be taking calls, 988 calls that come from area codes 225, 504, and 985, and it will also be backup to the other call center. The other call center is operated by Louisiana Association of Compulsive Gamblers, and that's located in Bossier Parish. And that call center will be taking 988 calls coming from the 318 and 337 area codes, and will also serve as a backup to via link to their call center as well. And so both of these call centers, they were previously in place as part of the National Suicide Prevention Hotline service. They are very experienced and seasoned call centers that are very knowledgeable in handling crisis calls and what resources are available. So 988 marketing and outreach. So again, we have to get the word out, and we're asking everyone and you all to help us get the word out. So on a national level, Vibrant, who's a national partner, is developing consistent marketing and outreach plans that will be rolled out in 2023. So again, this has been the first step, and we are continuing to, even on the national level, look at next steps. In Louisiana, the focus for the next 3 to 6 months will be on expanding in-state capacity to respond to the anticipated call increase. We will also be developing a more formal plan to begin outreach and marketing efforts to align with Vibrant's national plan. And OBH plans to meet with individuals and conduct focus groups to determine any needs and tailor messages for special and at-risk populations, such as the Black, Indigenous, and people of color, the LGBTQ population, communities at risk, service members, veterans, and their family members, and any other minorities or at-risk populations that we want to make sure we are getting the word to these communities and to these populations. And again, effective July 16th of this year, providers and other stakeholders can begin updating your websites, brochures, and any materials to include that 3-digit number for someone to call if they're in a mental health crisis. So the old 10-digit number will still work. It will just automatically roll over to the 988 crisis call centers. And here's some more websites, and I'll be happy to share the presentation with you all. Some websites with information, toolkits, resources on 988 and the transition, some logos as well that can be added to any printed materials. And again, we know that it's going to take a partnership to get the word out about 988. And we want everyone to have the same narrative and a common narrative. So we speak one voice to ensure everybody understands what is 988. It is now an available resource in our communities. And when should you call 988? And as we work towards this transformation together, we know that clear, coordinated, and aligned communication about 988 will continue to play a role in achieving our vision. We recognize the need to speak with one voice about 988 to ensure there is clear understanding about what it is and how it will work, and aligning our materials by building off of those that SAMHSA has already created and tailoring for our specific audiences. That will be critical at next steps moving forward. Okay. And the toolkit, SAMHSA's toolkit timeline. Again, these are some websites. You can go to SAMHSA's website. They do have toolkits there. Beginning in June, they had wallet cards that could be purchased or ordered for free through the SAMHSA store, as well as magnets. And then there's also some online resources like animated and static social media digital shareables that are available through the SAMHSA store that you can just go and download and put on your websites, and other resources to help spread the word. And there's also some Spanish, some resources available as well. So the collaboration between 988 and the new adult crisis response system and services. So as I mentioned, 988 was pivotal in this moment, and also developing crisis response services. And this is a national movement as well, with the mental health block grant, which is federal funding that comes to all states and territories for mental health services. There is now a requirement that a specific percentage of our funds are used for crisis services. So this is a national need that's being identified around the country. And we are excited in Louisiana to be implementing our new crisis response services to develop a further robust system, because we know 988 is that first step. And that once people call that service, call 988, call the line, they need to sometimes they are going to need ongoing resources. They are going to need somebody to go and lay eyes on them. They're going to need an actual person. They're going to need somewhere to go. And we realize that this is part of a whole continuum. The 988 number and having crisis response services is part of the whole crisis continuum for Louisiana. So the stakeholder work group that was established for 988 transformed into the work group that was helping to develop the crisis response system and new crisis services in Louisiana. And the main goal at this point was to develop, improve, expand, enhance processes within respective services while seeking opportunities for collaboration as the systems mature, both with the Louisiana Crisis Response Services and 988. So the Louisiana Crisis Response Services, there are 4 crisis response services that became effective this year, or some are becoming effective this year. One is the mobile crisis response, and this is an initial community-based mobile crisis response that is intended to help someone provide relief, resolution, intervention when they are in a crisis. This is a mobile team that will go to someone who is in crisis when there's a intervention needed. Someone needs to go and assess the situation. So the 988 crisis call centers are aware of where the mobile crisis response teams are and how to connect with them when needed. Behavioral health crisis centers are facility-based services that operate 24 hours a day, 7 days a week. These are walk-in centers that provide short-term behavioral health crisis intervention. Community brief crisis support. This is an ongoing crisis intervention response that's rendered for up to 15 days. Because we know that when someone has a crisis, it does not end in that moment, that there needs to be ongoing support, resources, someone to talk to. And more often than not, they're going to need something even beyond those 15 days. So it's connecting them to the proper resources, making sure that they have been stabilized through that crisis. And if they need to be linked to a behavioral health provider, a community-based provider, a social service agency for ongoing supports for what triggered that crisis, then that happens and they have made that connection. And then finally is crisis stabilization, which these are bed-based crisis services. So if someone is in a crisis, they need to be in a facility, have a bed where they can stay for a short period of time. We know this person is at risk of hospitalization or institutionalization, then they may be referred to crisis stabilization beds to help with stabilizing and hopefully providing the supports, intervention, resources to not need hospitalization or institutionalization. And who is eligible for the Louisiana Crisis Response Services? So that would be any Medicaid members who are 21 years of age or older. So right now it is targeting the adult population at this moment. The individuals, the Medicaid members have to be associated with one of the 5 Medicaid managed care organizations. They have to be experiencing emotional distress and would benefit from crisis response from trained practitioners and professionals to support them through this crisis in the community, and that they are not already on a legal commitment and that they are doing this voluntarily. That is not court ordered or being forced upon them by the legal system. And this chart shows based on the regions. So we partner with Louisiana State University Health Sciences Center as the contractor for developing the Louisiana Crisis Response System. And they have been going through an RFI process to identify providers for the various crisis services in each region, each local governing entity throughout the state. So this chart shows the current status of what services are in place in what areas of the state and what is the implementation plan, and also continuing to work on identifying providers for some services and some areas in various areas of the state. And finally, so that was everything on the crisis response system in 988. Wanted to also inform everyone that we have the Behavioral Health Symposium scheduled for September 19th to the 21st later this year. It will be a hybrid event of offering both in-person or virtual participation. Though anyone interested in coming in person, it will be at the Crown Plaza. And it's going to be 3 days of a lot of information, including 988, the crisis response system. The first day will be a Louisiana Opioid Action Summit, focusing on the Louisiana's continued response to the opioid epidemic. And then followed by 2 days of behavioral health focus on various topics related to behavioral health and responding to the pandemic and so forth. Our theme for this year is reflecting on our past, respecting our present, and renewing our future, and recognizing that we have all been through a journey for the past few years and how this has impacted us and how it has shaped our future, and looking to our future with hope, because we know there is hope. There have been lots of lessons learned, and we have a lot of hope for the future and moving forward. And finally, if there's any questions, and just want to close with this quote of, one small crack does not mean that you are broken. It means that you were put to the test and you didn't fall apart. Being lots of times we and those we love may be bruised or cracked, but we're not broken. And so many times we get calls from family members of just in desperation of their loved one is in a state of mental health, behavioral health, addictive disorders crisis, and thinking that's the end of the road for them. And there are so many supports and resources and supports available, services. So we encourage anyone to access those and contact our office or contact Medicaid Managed Care Organization or any of these resources for information on how to access this. So I will, that's the end of my presentation.
We have a few questions, Charlene, if you'll take those.
Okay, I see one from Jim. Is the state prepared to support the 988 system once the federal startup funds in? So great question, Jim. So we are all the states and the federal government are working towards sustainability. And actually, I know our Assistant Secretary, Ms. Karen Stubbs, would have loved to be here to do this presentation, but she has been at the National Association of State Mental Health Program Directors meeting in Washington, D.C. this week, and that has been a great focus of it, and what everyone says of how we're going to sustain it. So that is part of our plan moving forward, and the federal government's plan to ensure that it is sustained. So I can't say we are prepared yet at this moment, but that is definitely in our plan of how we are going to be prepared, because it definitely needs to be maintained beyond the initial federal funding. And that is everyone's goal, including the federal government. Are the stabilization beds, open to individuals with IDD? So these stabilization beds are going to be focused on the behavioral health population. So those with serious mental illness or in a behavioral health crisis. So someone may have an IDD in combination with that, and if they're able to give them the supports they need, it would not exclude them that they have an IDD, but the criteria that's going to make them eligible for the bed will be that they are in a mental health crisis. Okay, Jackie, use 988 instead of 911 for any behavioral health issue. That is correct. And there will be professionals on the other line asking questions, getting information. So they may determine that they do need to dispatch 911 or law enforcement, or it's a safety issue. They will ensure that that they will connect them to 911. But you are correct, Jackie. Use 988 instead of 911 for any behavioral health issue. Oh, and thank you to the anonymous attendee who said you enjoyed my quote. Thank you. And I've seen several organizations who support at-risk groups, BIPOC, LGBTQ, who are warning their groups of the negative consequences of using 988. Are there positive messages being sent out to the counter? So yes, and I said that's we are working on tailoring the message to reach those at-risk and groups so that we're engaging that population. So that's a great point. We want to speak their language, and we do not want them. Messaging is important. Our words are important. And, we do not want anyone to be afraid of negative consequences for calling 988. And that's part of our next steps with it as well, is engaging those high-risk populations in the conversation of How do we reach them? How do we ensure they are using the resource? And how do we help them to feel safe and like they are heard and they are engaged in the process? Great question. Thank you.
And Charlene, can you provide that presentation to me so that we could share with the attendees? You had a lot of great links in there, and want to make sure that people get that information.
Yeah, sure. I'd be happy to, Bambi.
Okay. And I guess I don't see any more comments or questions. So I guess we'll go ahead and end it. This great presentation concludes the first half of our conference, and we really appreciate you, Charlene. It's always engaging to hear the many type of programs and stuff that are happening with Office of Behavioral Health. So thank you for sharing that with us today. And we will adjourn, and our conference starts in the morning on Wednesday at 9:30. So we'll see, hope we see most of you at that time. Thank you.